Hello friends, my name is Sumandev. Today we'll learn about section 3 of module 1 on diabetes. In this section we'll learn about various signs and symptoms of diabetes, then risk factors of diabetes, and lastly we'll learn about various diagnoses of diabetes. Now let us understand various signs and symptoms of diabetes. Before we understand the signs and symptoms of diabetes, let me tell you that there are 5 major signs and symptoms of diabetes, and after understanding these signs and symptoms, doctors understand that the person whether he is suffering from diabetes or not. First one is polydipsia. Polydipsia means excessive thirst. Then polyphagia. Polyphagia means excessive hunger. Then fatigue or weakness. Diabetic patient, it has been seen that the person becomes tired very fast. With less amount of physical activity also they become very tired. Then is polyuria. Polyuria means frequent urination. And then weight loss. So these are the major signs and symptoms of diabetes. Now let us understand various risk factors of diabetes. The first one is inactivity. Now less activity leads to increase in body weight, and at the same time less active person utilize the body's glucose to a very lesser extent, and that increases the chances of diabetes. Second risk factor is race. Now in race, it has been observed that Hispanics, American Indians and Asian Americans are more prone to suffer from diabetes. Age, if it is more than 65, the person may suffer from diabetes. Obesity, if the BMI, body mass index, is more than 30, the person is more prone to suffer from diabetes. Hypertension, high blood pressure, is another very important risk factor of diabetes. Nowadays, because of the lifestyle changes, what happens, stress has also increased in our life, and this stress, it has been seen that as the stress level increases, the chances of diabetes mellitus also increases. Family history is another risk factor of diabetes. If a person's mother, father, brother or sister, they are suffering from diabetes, there is a high chance that the same person may suffer from diabetes. Certain medications like steroids can also induce diabetes. And lastly, high cholesterol intake can also lead to diabetes. Especially if a person's triglyceride and LDL level is high and HDL level is low, then there is a chance that the person may suffer from diabetes. After a patient goes to a diabetic consultant and doctor understands the signs and symptoms, and then he evaluates these risk factors of diabetes. After evaluating risk factors of diabetes, doctor is almost sure whether the patient is suffering from diabetes or not. However, for final evaluation or diagnosis, he asks the patient to go for diagnosis, that is blood sugar level check. Now let us understand the diagnosis of diabetes. Diagnosis of diabetes can be done by blood sugar level check. The blood sugar level check are of two types. One is FPG, that is fasting plasma glucose, and PPG level check. PPG stands for postprandial glucose level check. Fasting plasma glucose level can be checked after 12 to 14 hours of fasting or overnight fasting. And postprandial glucose level can be checked 2 hours after food or heavy meal. The other way of diagnosis is glycosylated hemoglobin level check. With the help of glycosylated hemoglobin level check, doctor can understand the average blood sugar level for last 3 months. Frequency of lab assessment is subject to flexibility based on the clinical judgment of the patient's current control of diabetes and past lab values. Now let us understand the blood glucose level check, especially with respect to fasting plasma glucose and postprandial glucose. As per American Diabetic Association, the blood sugar level can be measured in terms of mg per dl, as you can see in this chart. Now, blood sugar level can be checked with respect to fasting condition and postprandial condition. Fasting, as I have shared with you, it is 12 to 14 hours of fasting, and postprandial means 2 hours after food. Now, after a person checks the blood sugar level, they get the values. Now, these values can be either normal or pre-diabetic or diabetic. Now, in case of fasting condition, if the value is in between 70 to 100 mg per dl, then the person is a normal person. And if the value is in between 101 to 125, the person is a pre-diabetic patient. That means neither the patient is a normal person or diabetic, but he is or she is progressing towards diabetes. The last one is in fasting condition. If the value is more than 126 or more than that, then the person is a diabetic patient. In postprandial cases, that means if the person checks the blood sugar 2 hours after food, if the blood sugar level values remains 100 to 140 mg per dl, then the person is a normal person. He is not suffering from diabetes. If the value is 141 to 180 mg per dl, the person is a pre-diabetic patient. That means the person is progressing towards diabetes. And if the value is more than 181 or more than 181, the person is a diabetic patient. Now, this value is very important and we need to remember these values. We need to remember these values because these values will help us when we will do diabetic camp. These values will help us to tell the doctor whether the person is a normal or pre-diabetic or diabetic patient. Now, next diagnostic process is glycosylated hemoglobin level check or HbA1c level check. Now, as you know, hemoglobin is very important component of our RBC or red blood cells, and this hemoglobin is responsible for carrying oxygen and carbon dioxide. Now, if you see this terminology, that is hemoglobin, this hemoglobin can be divided into two components, that is heme, that is iron, and globin is protein. Now, what happens when the blood sugar level increases? This excess glucose bind with this globin, and that is the reason it is called as glycosylated. That means glucose bound with protein, glycosylated hemoglobin or HbA1c in short. So, glycosylated or glycated hemoglobin is defined as hemoglobin that is irreversibly glycated or bound with the protein. Once the hemoglobin molecule is glycated or bound with the glucose, it remains in the red blood cells for the rest of the lifespan, that is almost 120 days. And then this HbA1c provide information about the degree or average blood glucose level during the preceding 10 to 12 weeks or on an average for 3 months. Now let us understand the different values of HbA1c. HbA1c is always expressed in terms of percentage. That means how much percentage of glucose has been attached to globin. As you can see the values, the following are the result when HbA1c is being used to diagnose the diabetes. If the HbA1c value is 5.7, then the person is a normal person, or we can say the person is not suffering from diabetes. If the value is 5.7 to 6.4, then we can say the person is suffering from pre-diabetes. And if the value is more than 6.5 or higher, then we can say the person is suffering from diabetes. Thank you very much for your patience listening.